Our golden years are meant to be enjoyed, shared with people we love, a time for relaxation and reflection. But as we age and our health deteriorates, that can be hard on us and our families. And that is when Care Patrol can step in and walk us all through the process of finding a place to call home. We've got Nick Wake. He is the Director of Business Development with Care Patrol. Nick, thanks so much for being with us.
Yeah, thanks. Happy to be back. We love coming here.
Yeah, well, we love having you. Let's talk more about Care Patrol and all of the services that you provide to families.
So, Care Patrol, just kind of to recap, is a no-cost senior advisory service. We help families find independent living, assisted living, memory care, and home care. We're kind of like a realtor in that we actually set up the tours. We actually get to know our clients, what their needs are, what their wants are, and then try to make those recommendations. And we actually take them on the tours. We also disclose violation histories as well to make sure that people are making informed decisions. And the best part is we're no cost to the families. So when they're stressed, they're working through these issues, it's very important for us to be able to provide those services and not add yet another additional burden.
Yeah, and a lot of times people come to you when it's an emergency, but this, give some advice to people, if they are nearing this stage in their life, when they should be having these conversations, when they should be coming to you, and what kinds of things they should be thinking about before they come to you.
Oh yeah, well, that's the biggest thing too, is nobody ever expects to get old. I mean, I say I don't expect to be 39 this year, but it's going to happen. So, but the one thing we always used to say, and something that we're saying again, is that we should really be having these conversations in the living room, not the emergency room. Trying to plan out what you want to do to be able to tour these communities in a non-emergent state, as well as just really looking at, if you've got to be on a wait list, what that timeline looks like. Because if it is an emergent situation and we're trying to discharge from the hospital, your options become kind of limited. Now, we've got a rapid respite program we've worked with a lot of our communities on, where they're holding beds for us so we can buy some more time. But again, that's not ideal. So thinking about where you want to go, getting finances together, figuring out what your assets are so you know what kind of thing you can afford, as well as what do you want out of a community. So those are things we're looking at.
Yeah, absolutely important decisions to make ahead of time. So let's talk about this Aligned Care Initiative. This is something new that you guys have been talking about.
This is, and I think I spoke a little bit when we first announced it, but we're doing a franchise-wide kind of relook at how we're doing things and offering a proprietary certification for our franchisees to really drill down. So when we talk about that, figuring out what people need, we're going to be looking at 8 dimensions of care. So not just the financial, the physical, and the emotional, but now we're going to be looking at spiritual, occupational, environmental. We're going to really be targeting these really key factors for success, but it's also based off the value-based care model that CMS is trying to implement by 2030. And so we're looking at better outcomes, and especially when we're talking with hospitals and they're looking at their readmission rates, to be able to drill down on that data and really find that placement that's going to help deal with these issues and create a safe environment for somebody. We're really going to be focusing on that.
Okay, so obviously creating a safe and comfortable environment for these seniors is key. Talk about the other trickle-down impact of thinking about all of these different factors when you're placing someone.
Well, and so we're going to be looking at these communities that can best provide these things. So again, if spiritual is very important to you, we have a lot of spiritual-based homes here. We've got places that are going to be on lakes and rivers or in the woods. You've got small group homes, you've got the large communities. And so being able to really drill down on that and be able to make that recommendation, but also that physical aspect, because we want to make sure we're not recommending a community that, maybe we can handle a 2-person, maybe we can't. We want to make sure that they're going to be able to do it. And that Aligned Care certification, the Aligned Care program, is really going to help us drill down on that. So quality placements, probably healthier placements, I would say. That's the goal, a safe environment for your loved one.
Absolutely. All right, and you're actually an ambassador for the program. Well, what does that mean?
I am going around talking about it. We're going to actually be an early adopter, so we're going to be beta testing it. We have a fairly decent-sized team here in the Grand Rapids area. All of them come from healthcare backgrounds, so they understand the value-based care model. And we've already started interfacing with some of our hospital partners to see what that looks like, because they're also developing a value-based care unit. So kind of working hand in glove to facilitate the best outcomes for our seniors. And I love talking about this stuff because, frankly, seniors need as much help as they can get, because the system isn't getting simpler. It's getting, or more simple, it's getting complex. And it's getting more complex by the year, so I think our service is desperately needed. But again, this system is going to allow us to create better outcomes, and whereas I think we have one of the best teams out there, we can always be better.
Wonderful. Well, Nick, we really appreciate all of the great work you do for families across West Michigan. And you don't know you know it, you need it until you do. And starting early is key, as you heard him speak about. You want to learn more? Reach out to Care Patrol. Ask them the questions. They are the experts. They are here to help. carepatrol.com/WMCR for our regional offices, 616-773-2085 if you want to get someone on the phone and ask them those questions. We'll be right back.